If everyone can take their seats, we've got the music stopped. I hope you had a nice break, but let's hope that didn't break our conversations. I think we've really had some great conversation with the panels today, and I know that with our panelist expertise, we've had some awesome conversations and comments, and hoping that you can all network from this event. I know there's been a lot of people sharing ideas and thoughts, so please make sure you connect before you leave today. That's the whole purpose behind this today, is the communication, the collaboration, and the things that we're doing to share what we're doing with youth and families. So this panel is titled Generational Substance Use Disorder. We have Dr. Laurie Solomon back up the stage for us. We also have Dustin Perry with Lakeview, and of course our expert panelist, Dr. Stavros, to also join in on this conversation. So I'll be running around with the mic. If you need anything, holler and I'll bring you the mic. So, Mark?
All right. So I don't know why they put me on this panel, because I'm going to speak at anything anyway, so it doesn't matter. So I'm just going to jump in and say something. So, all right. This is generational substance use disorder. Any pressing questions out there, or do you want me to start it off? Okay, I guess I'll start it off. Actually, I already warned Dr. Solomon I was actually going to kind of ask her a question. So you showed an interesting slide in your presentation that showed kind of the genetic kind of downflow of addiction and how it's a genetic disorder as well. Can you maybe expound upon that a little bit?
So it's by genetic disorder.
Does she need to hit the switch? Is there a switch on that mic?
Okay. So as far as it being a genetic disorder, where all psychiatric conditions are genetically linked, meaning that the genes in that family group, when a person inherits certain genes from somewhere in the family, that they have a brain wiring. And so in the diagram that I showed, not everyone is affected. And that's what a lot of patients actually that are even in treatment with us become fearful that, well, I have this condition, but I also have a 10-year-old at home. What do I do for my 10-year-old? But then educating that person that you're not necessarily going to pass those genes, but if you did pass the genes and the wiring is there, then you want to just be more vigilant with providing education or looking for red flags as the child grows older. But then again, bringing it back to that individual that says, I have this my 10-year-old at home, that brings on another layer of guilt for that patient. And so then educating them again about, like any other medical condition that's genetically related, coronary artery disease, hypertension, forms, some cancers. It doesn't mean that because you have those genes that you gave that person that's what they came with. And such as even having a diagnosis of type 1 diabetes, that's a chronic, lifelong, relapsing illness. Same as substance use disorder. Did you ask for the diabetes? Did you ask for that pancreas without those cells to produce insulin? No. And it's the same as substance use disorder. Did we ask for these genes, this brain wiring, our brain to be developed this way? No. But it's what you're provided with and what you have to do to take care of yourself.
Any comments, any questions out there? No? I remember my mom telling me when I was younger about drinking, and that, my risk for becoming an alcoholic was higher in our family than other families because I had family members that had alcohol issues as well. That was kind of important for me to know as a kid. Again, opening up, talking real with your kids, talking about the reality of what some of the downsides are to drinking as well. And so it kind of helped. That was always in the back of my mind when I took a drink, like, okay, am I going down the wrong road? Uncle Jerry had this problem and I don't want to go down that road as well. So it was always evident. So have those discussions with your kids, be open about that as well. So that was just a total aside. So any questions at all out there? There we go. I'm going to pay you later for all the questions.
Thank you. I was just commenting to my colleague over here. We have a new counselor. He graduated recently with his bachelor's, also peer, and he is really interested in addictions. And I was talking to him about nature versus nurture and your genes versus your environment. He kind of looked at me, just that blank stare, like he had no idea what I was talking about. And the analogy I gave him, I said, well, when you go see your primary care doctor, you give a history, a medical history, and a family medical history. And he's like, yes. And I said, why do you think your doctor is interested in your family medical history? And he said, well, because it runs in the family. And I said, exactly. It runs in the family. It's the genetic part of it, the genes. And too often, I don't think people really think of addiction as a medical disease and disorder. They don't, like the diabetes and the hypertension, etc. And I take blood pressure medicine every day. Thanks, Dad. I, have osteoporosis in my arm. Thanks, Mom. But I know those things because people talk about it. And if the more we can normalize and relate it to primary care, other things that we're doing, again, getting your medical history, then again, it reduces the stigma and people can relate to that. It's like, oh, okay, I get that. And we tell our clients, we teach them, this is the same when you go to see your medical doctor. Measurement-based care. I explain what is measurement-based care. When you go to see your doctor, they do your weight, they take your vitals, they take your blood pressure. That's why we do these screenings and we measure from session to session. But when you use the analogy of primary care, the light bulb goes off and people tend to say, okay, I get that. I can relate to that. So again, just sharing.
Great point.
Oh, you're thanks. So the Volusia Recovery Alliance is an RCO, and we respond to needs in the community. So I have a certified peer who came to me one day and said, because he was in the NICU trying to help a friend of his, and it came to the surface that they were trying to help the mom, but they were trying to arrest the dad. And so Rhino came to me and said, you know what, there's no resources hardly at all for dads. And I said, okay, let's come up with something, because we're blessed to get funding for outreach from LSF and the department. We're able to do some things that other people aren't doing. And so we developed a program called FIRE, which is Fathers Inspiring Recovery and Evolution. And those dads meet in our offices and talk about ACEs and protective factors. And so for us, we don't work directly with youth, but we work with a lot of parents. And so working with parents is the opportunity for all of us to break the cycle of generational addiction and substance use disorder and mental health challenges. And, I come from a long line of relatives that used too much alcohol. And when I hit my bottom in 1982, and I was working for my dad, who was my biggest enabler, I said, I got to go to treatment. And he's like, no one in our family ever had a problem with alcohol. And yet my Uncle Jimmy had the DTs more often than not, right? Every time he went in the hospital, he would have the DTs. But that generational cycle didn't get broken because I was the first and only person in my immediate family that found recovery. And so the more we can support families in recovery and heal families in recovery, that's where the solution is, to start breaking that cycle. And I can't say enough about it, because that Rhino was Narcaned 18 times, and today he's got 4 years of recovery, and he's a new dad. And he's the stepdad to a kid that lost his father to an overdose. And that's how we break the cycle, is telling our stories and making sure that parents get the resources that they need to help their kids and to help themselves. Thanks.
It's awesome. Yeah, just continuing those discussions and those stories will help break down the stigma too. The stigma's real. 18 times Narcan. I've heard cops before, yeah, they get 3 and then I'm done. What? like the fourth time they should die. I mean, that's kind of crazy, right? But those are great stories to share. It's like, it's, you know, as long as they're staying alive, they have one more day that they can make a change in their life. They're alive to at least keep on going. That makes a difference. So other questions, any comments on that? You just have to listen to me banter if you don't say something, and I'm super boring. One thing I found that's interesting is epigenetics. I don't know anything about epigenetics. I just read some stuff about it, but, you know, so, you know, stress in mom's life during in utero will actually make certain genes get expressed differently. So they did this huge study in Europe when there was this huge winter time and people were starving. And then that whole section of people that were born during that time, as they grew up in life, they had higher diabetes, higher hypertension, all these different things in life because their genes that were maybe not at risk before are now being expressed and they're at risk for these things. Same thing is kind of with drug use too, and even marijuana. I don't know if all of you are aware that marijuana, just marijuana cannabis, can actually express some genes of schizophrenia that may not have been expressed had they not been exposed to it as well. So having those conversations with our kids saying, yep, you know, it might be fun and you're just experimenting, but there are some downsides. That's one of the downsides too. You may have irreparable harm that you can't go back and fix.
Sorry, friends. So off that thought, I had this question, but great that you brought that up. Is there anything in research or literature that points to any type of genetic marker or maybe a mental health indicator that might point to what's the proper term? Someone being more at risk for developing a substance use disorder later in life, like even if they weren't exposed in utero? Is there any type of research related to markers that might say, hey, you might be predisposed to having this condition later?
Like the HER2 gene for breast cancer.
Yes.
Unfortunately, as far as if there is, I'm not necessarily aware, but understanding the genes in the family is more of the marker, I believe.
Yeah, I think there are some ongoing studies with that. So for instance, and again, I'm not an expert in psychiatry at all, but you know, we can do some testing on patients to realize what antidepressant is going to work for that person and which one's not gonna. My brother had this huge diagnostic study done, and he said, yep, I'm at risk for methamphetamine use disorder. So there's something out there that does some type of marker. I don't know exactly what that is, and I'm not sure that's actually prime time for everybody to do. But the bottom line, he was able to kind of delineate what might work for him, for his disorders, what might not work for him as well. So I think they're exploring some of those things. I know there's certain...
it's the MTHFR gene.
Yeah, there's other genes that can be expressed differently, like, hey, you know what, this drug's not going to work for you very well, or I think it's naltrexone. Like, naltrexone is going to work for this person, but it's not going to work for this person because of this certain gene that they may have. So they're exploring that more and more, and I'm not well versed in it, though. So.
And also with gene testing, there's measuring of the metabolism of the liver, the P450 system, of the different enzymes that are in your liver that metabolize these medications, which can demonstrate, is this person a slow metabolizer, a rapid metabolizer, or a normal metabolizer? And then that helps choose which medication, because there's so many medications in each family. And the reason why is because people respond to them differently.
Yeah. I had a question. About epigenetics, could recovery over generations alter those epigenetics? Could recovery become a predisposition as well? Could we change that 3 or 4 generations down the way?
Yeah, I'm not sure from a genetic standpoint how that works, but like she had just said, you know, you're breaking that cycle. That makes a big difference, right? It's kind of cool right now, in the last couple of years, how much we're talking about opioid overdose and treatment. I mean, my goodness, we all have purple shirts on. We're out there. I mean, of course, we're in the field, but I see that kind of all over the place. People are starting to talk about it a little bit more. It's not that little, he's got cancer. You know, he's got an opioid problem. You know, it's being talked about a little bit more openly, which I think is going to help our youth, you know, being able to open up and talk about these things like, this is kind of life. These are the things we're dealing with, and we're not going to be hush-hush about this, and I think that helps a lot. From an epigenetic standpoint, maybe. I don't know. We'll have to wait a generation, maybe. So.
Can you hear me?
Got it.
Okay. And so I asked I didn't want to get super sciencey. I have a PhD in pharmaceutical sciences, but I specialized in health outcomes research and pharmacoeconomics. And so I asked the question, thank you so much for your piece, and thank you for your additional piece. I asked the question to see if would it be valuable to have that type of research? Would it be valuable to know or to be able to even test if someone would be predisposed to something like that in the future? You mentioned like the HER2 gene. Now people can say, well, I have this, so let me go do some preventive measures and that sort of thing. And so when we talk about generational substance use disorders and we're thinking about the youth that we're serving all across the state, just me thinking about trying to brainstorm some additional things we could be doing now to kind of get some better interventions, get some better resources, some more preventive measures and all that kind of stuff. So if there would be value in, if there isn't research currently for something like that, maybe we need to do something like that. And if that's valuable, okay, cool. Yeah.
I think that'd be huge. That'd be wonderful, yeah. If I knew you were predisposed to a certain thing, then I kind of know how to address that a little bit. And I think, even if I prescribe something, right, if I'm going to prescribe pain medications for you, we might have an extra discussion about, there's a risk here because you actually are at risk for developing an addiction more so than this other person that doesn't have that gene, so that those are valid conversations to have. So, yeah, I think that'd be great information to know. Any other thoughts?
This is way above my head. No.
Hey, I'm making it up. So.
No, you're doing great. I think the one piece that has to be considered there is the expense that comes with a lot of these things. Pharmacogenetics is very expensive. It may be a great tool, but it's not affordable for me and my family. It may be affordable for some of your families, but it's really not affordable for the families that are out of the community doing labor work every day if they're working at all. So I do appreciate the idea of the research. I know that we're decades away from that being affordable for most of the users that we encounter, which is my concern. We've talked a lot about genetics, but I think that sometimes we miss out on the things like the social aspect of it. Does your child go to pharmacy high school, which becomes a social problem? And when we grow up in these neighborhoods where people are using all the time, and we're looking at the generational aspect of substance use, it may be the genetic piece, right? And that may be a problem, but it may just be the problem of everybody in the family's used, right? Working with your dad, and he's using, and your uncle's using, and grandma's using. We've got people that come through treatment and they go, why would I ever get sober? There's not a single person that I know that's in recovery. How do I do that? They don't know what sober looks like because their neighborhoods are using, their jobs are using, their parents are using. So we have to be able to disrupt that and provide that avenue as well, which does impact the generational piece aside from the biological piece as well. So maybe I introduce a new question for you, Dr.
No, I like it. That's good.
And if I could add, by involving the community and I know for our treatment program, and I'm sure other treatment programs, that we have like annual events and we have a 5K run and in the name of, recovery and healing and stomp the stigma, and with NAMI as well. But to have these events that make it more normalized, if you will.
What are some of the other things that y'all are doing out there that are family friendly? Getting the family involved, that's addressing the underlying substance use disorder, maybe in youth, maybe in the parents. Anybody do anything kind of like what she's talking about, the 5K and getting people involved, discussing it?
At Discover and Recover in St. Johns County, where I work, we do a lot of like unconventional groups. One I host, and a lot of people like it. I like doing a lot of sports and stuff, so I host like a recovered pickleball kind of thing. So I go to this place called Treaty Park up in St. Augustine, and from 3 to 5 every Friday, I invite people out to play pickleball with me, and it kind of just, the fellowship, the people like-mindedness, the recovery communities come out, and we get to enjoy playing pickleball, but we also get to enjoy on loving each other. And I really enjoy coming up with hosting different kind of groups in the community like that. just to find different ways to love on each other and get people out and active, maybe people that would normally be isolating or something like that inside their place, that they can come out and they know that they can be in a judge-free zone and be able to fellowship with like-minded individuals.
And annually, we also have a dinner for our alumni, of which alumni come back every year. And since COVID, we have a virtual version where it can be hybrid, where people around the country can even attend when they're alumni. But this helps understand that we do like a countdown from a 35-year down to a 2-day countdown of being in recovery or getting into recovery, and it helps provide that inspiration for hope, and that people can do it. If they see others do it, they can do it too.
So back in Indiana, in my prior life, we tried to figure out some kind of pro-social activity for the clients that I had, and they all wanted to do softball. So we did a co-ed softball team, invited them to have their families there to try to make it a family event. They named their team as Getting Past Struggles. So it was Team GPS, and a lot of them clients were wearing ankle monitors. But it was one of the things that we really tried to get the family involved, so we could show the kids that, yes, my dad may be, in a program, maybe wearing a bracelet, but these are the positive family things that we can do that don't involve. They went on to win a championship last year. So, and you had guys and girls playing together, and it was not that idea of having to go out together to be social. And they are keeping it up. They are doing it on their own without support. They look forward to it every year. I hear from my friends back in Indiana, but it's getting them involved in a pro-social activity that really can bring the family together and show that it is okay to get past your struggles and be a part of a family cohesive that's not using.
All right, this question is for the panel or anybody else out there. So you're talking to a kid that has a substance use disorder, and you're trying to explain the reasons why it's bad and trying to get them to stop and explaining all these things. But yet they kind of go back to like, what do you want me to do? My mom and dad are using in the home. Like, how do you address that? What can we do to kind of approach that child or that youth in that way? And what recommendations would you have to say to that child?
I think Taylor said it great earlier. Disrupt it. Is this what you want? Connect it back to, if your dad is doing this, is that what you want to do? Do you want to achieve the same goals as your father? Do you want to achieve the same goals as your mother and your neighbor? Or do you want to do something a little different? And if you want to do something different, how can we disrupt that? How can you do something different? What's an activity that you can do today that might change the outcome tomorrow? And what's something that you can do over the next week that's going to change next month? And start out really, really simple goals and get them invested so that long term they can make those changes. I have encountered the situation where they go, I don't see any difference. I'm going to be just like them, and there's no other way out of this. And I think, like the school boards, we just be persistent, right? We continue to attack, and we continue to engage, and we continue to provide that insight and that support until they come around and provide that avenue so that when they do decide that they're ready for that change, that they know where to come, right? Don't make this a barrier for them when they do go. That idea of discharging somebody from treatment is pretty insane to me, right? Because we're the place that people should be coming. We've talked about the doctors, and if you don't take your insulin, are we going to discharge you? And we wouldn't. So why are we doing that with treatment? Why are we not being the place that they can come back to anytime that they feel uncomfortable? So keeping the doors open, making them feel comfortable, and they may not be ready at the moment, but allowing them to transition back out in the community with that open door that when they come back.
Hi. I guess my major concern is a lot of times we just jump into trying to treat the substance without treating the trauma. and the reason for the substance. And a lot of times the trauma is generational, and it continues to manifest. And until we deal with, like you said earlier, like the ACE, as to what brought this person there, what brought their parents there, what brought, it will continue. And like the young lady said, until you are of sound mind to say, look, you know what, let me deal with X, Y, and Z so that this is where it stops, it will continue. And I'm coming from the therapist perspective, where it's not just the medicinal, it's not just, the community, it's the trauma. And some of the stories that you hear, it's mind-blowing that this person continues to exist on top of everything that they've had to deal with. So I don't know how to even begin to answer that, but like for me, whenever somebody comes to me, it's again, let's kind of go back to what brought you here.
And that's the dual diagnosis patient, which is the most common patient. Actually, when you find somebody when there's just an alcohol use disorder or just a cannabis use, it's rare. Happens, but it's rare. And certainly when the person goes to treatment, at least from my experience, that the substance, whatever that substance is, that's just the symptom to a bigger issue. And that's what treatment is about. Of going through all of these assignments, going to brain college, learning about yourself, understanding what are those underlying issues and addressing it, just like suicide. Suicide's so preventable. It takes 70,000 lives a year. It's a symptom to a bigger issue.
Yeah, I think in treatment, one of the things that we do is we do try to treat the underlying symptom. We have an adult drug court, we've got residential substance use, we've got outpatient, we've got our MAT programs, and I don't think that any one of my groups says stop using drugs. I don't think that we have one that says stop using drugs, right? They're all at that point that they're with us, that they all either want to stop using drugs or we're working on something else. Very rarely is it that we have to say, look, if you're using drugs, and this is later on, right? This isn't the prevention intervention piece, but we're not at that point where we have any groups on how to say no. We have groups on how to say no in the future, right? Once you're in recovery and you're running into those people, but very rarely do we have those groups. It's really about that broad piece, the trauma, the mental health, the legal piece, the employment piece, the career piece, the family, the communication, the boundaries, all the other things that go to support the recovery, and very little do we talk about drugs.
And if I could add, especially since the pandemic, that we have seen, and as an evaluator for the state of Florida, we have seen that burnout is such a huge area that has led, if someone is predisposed to develop a substance use disorder, and it's come out for the first time in some people as a result of burnout. And there's actually tools, a burnout assessment tool, that you use to measure those different areas of burnout. And it's very prevalent. We've seen a lot of that, especially in healthcare professionals.
Hi, guys. I believe that every person here, together we can make a difference. Because each person here is strong in some specific items from a specific thing. That's why we're here. So every person, our job is really, really grateful. It's stressful. It's heartbreaking. So at the end of the day, when we're going home, we're exhausted, and always say, how I can help this person. So we're trying to sleep without thinking what to do tomorrow. So we're here because we care. Otherwise, if we're not doing what we're doing. Mm-hmm. If what we're doing, we never get an answer like no. When somebody tells me no for whatever reason, whatever, that wake me up. Like, here we go. Now it's a gate changer. Because I never accept no like an answer. that's what I'm doing, and I continue doing it the best I can.
And bringing it back to these annual alumni dinners that we do, as far as the alumni coming back, that gives us as the treating professionals inspiration to continue to do what we do, because we don't always see the good stories. We see a lot of the unfortunately bad outcomes that can happen.
And on that point, I wanted to circle back to the comment we made about those youth that are treatment, and we're talking about, do you want to be like your parents? Do you want to follow down this path? And if they are saying, I don't see the problem with it, I want to be like them, what's the issue? A lot of times it is because they haven't had that other role model or someone to show them any different. So I think one of my questions is, are there any maybe programs where we can have the adult alumni partner with youth that are in treatment and maybe do, like a family bowling night, so they can see that environment where people have changed and they can have fun and they don't have to follow down that path? I don't know if that's something that's currently available, but that's just a thought that came to my mind that I thought could be a really unique experience to maybe break that idea.
It's a great thought. Anybody doing anything like that? Lakeview doing anything like that?
Well, I could say, as far as not necessarily youth and adolescents, because we're an adult unit, but on our medical detox unit, we have our patients who are in our PHP program who are at the other side of they're getting close to discharge, so they've been there almost 3 months or so, and we have a program called mirroring, where we'll send patients over to our detox to give inspiration and hope and understanding that and if there's somebody that's on the fence about treatment, we definitely have them focus on that person, and then spread the message, spread the word. And it changes, and it helps so much. We've gotten so many people into treatment, and they don't necessarily come to FRC, but they'll go to another program. Or if they're almost there, they're sort of pre-contemplative, contemplative, they know they'll at least come back. And then maybe when they come back, they'll remember that and go to treatment.
So as part of that FIRE program that I mentioned earlier, we did a bowling event with the families, and then most recently, we got some funding from one of the churches. So we did a family event at Daytona Lagoon so that they could practice some of those protective factor things that they've learned in the previous meetings, but it was a way for the families to get together and just make new memories, and it was really successful. So that's two things that we did with the dads.
And through Teen Al-Anon, I believe also would be a way to get the message, why do I do this different? Well, and they see a peer leading a better life or a different life.
We have about 5 minutes left for this panel. Do we have any other questions? Comments? Dr. Stavros, anything?
Well, I can chit-chat all day.
I know you can.
I will tell you one thing that Dustin just kind of talked about is it's not really a question, it's kind of a comment. And it's been a change of thought in the way that we approach patient care sometimes. It's like, again, we always are like, I know what the best treatment is for you. I'm the medical provider. This is going to give you the best outcomes. But again, just kind of engaging with patients like, we're talking about stopping drug use. That might not be one of their goals. And that's okay. Right now, it's like, okay, let's talk about the other things that are important. Let's change other things in your life. And we hope that your drug use actually starts to lower. What are good outcomes? A lot of times people are like, oh, good outcome is they're abstinent from drugs. That's not necessarily the best indicator of outcomes, right? If somebody's still using fentanyl 6 months later and they've been in treatment, is that a failure? Well, maybe not, right? Maybe they're still using, but they're using once a week. And they used to be using every day for 10 times a day or whatever the case might be. Is that harm reduction? Is that improvement of human life? Absolutely. And so sometimes I think we equate success with abstinence, and that isn't necessarily the end goal. We want to keep the patient alive. We want to help them thrive in their lives. And hopefully we'll start seeing that with motivational interviewing and treatment, that they're realizing, like, these drugs really just aren't helping me. You know, this is something I can get rid of in my life because I have other things that are more important in my life now. All right, just a comment, not a question.
All right. Any final comments, panel? Before I step away? Any comments from the audience? All right. Well, appreciate it. Thank you so much, Dr. Salman and Dustin, for participating, and Dr. Stavros. Our next panel is on prevention and intervention in the home and community designed for children and youth. And we have Lisa Jones-Bryan with Hanley Foundation and Shelby DeVries from Hanley Foundation joining us for this panel. And Shelby actually asked a question last time, so I'm sure she's got a lot of great information to share.
No pressure.
No, he's not going.
Dustin, it has your name up there.
I know it does. I know.
You've been a trooper. Right, so this next section actually is kind of a nice little segue, kind of what we've been talking about a little bit involving families as well. So prevention and intervention in the home and community designed for children and youth. That was a tough one to say. All right, anyways, why don't you all introduce yourselves, tell us a little bit about yourselves and the Hanley Foundation.
Okay, can you guys hear me? Perfect. My name is Shelby DeVries, and I'm a prevention specialist with the Hanley Foundation. So quick little brief description of what I do is basically I go into our schools and I give substance use prevention programs to our youth. That is a very simple way of explaining what I do.
There we go. My name's Lisa Jones-Bryan. I just recently got married, but I haven't been able to change anything lately because we got married on a cruise ship, so we're still waiting on all the documents. But anyways, I am the prevention training coordinator, so I do all the training for not only the Hanley staff, but folks around the state of Florida. I'm also the lead coordinator for the certification program or the study group for those who are wanting to go through to become either a CPP or CPS for the prevention side of certification. But Hanley Foundation, we are the all-encompassing. We go for the whole treatment of care. So we're all from prevention through recovery. So we hit all the dynamics there. So some of the things you guys are talking about, we do at the Hanley Foundation as well.
All right, any initial questions? Go to the cheat sheet if I have to. So, all right, so kind of in line with what you're just talking about doing in schools and things. So what are evidence-based interventions that support children and youth and their families in recovery that decrease the likelihood of relapse?
That's really a hard one because it's not something that we actually do for relapse part of it. So we're more in the realm of prevention before they come in. It is one of the things that we are looking at our center, having a family program, but we were just getting that up and going. We have not started that yet, but it is getting, as the doctor said, getting the whole community involved, who can all be there at the table as the family's going through so that it covers the whole entire spectrum of care for them, to know what they're dealing with, who is that circle of care around them that can help them through that process.
I'll briefly add on to that. In terms of the prevention side of things, the Hanley Foundation, we offer a program called Teen Intervene, if you're familiar with that. And basically that gives students a second chance. If they've started to use a substance, they can go through this referral program and it will allow them to work with one of our prevention specialists and really look at their coping skills and what they're going through, why they were leaning on that substance, as well as getting their family involved. So hopefully once they've gone through this program, they can make better choices and they aren't using substances. But that is kind of a little bit out of our realm in terms of prevention, but that would be one program that would be most applicable to that.
So Shelby, can you expound a little bit about when you go into schools and you're given education, how are you doing that? Who are you addressing it to and how are you approaching it?
Absolutely. So when we're going into schools, we are providing several different programs based on our counties, but typically what happens is we do have to get in contact with our teachers, our principals, school board, whoever that gatekeeper may be, so that we can get into those schools. And oftentimes you'll see our programs in like PE or HOPE, health-based classes, sometimes science classes. And our programs, we do have them available from starting at 5th grade all the way up to 12th grade. And most of these programs are going to be evidence-based programs. So we're going in as a resource to these youth. We're not doing the just say no or any of the scare tactics. We're going in there and telling them about prescription drugs and how to, make a healthy decision after you get your wisdom teeth removed and maybe your doctor offers you an opioid. You should be asking those questions to your doctor and giving them those those skills to make healthy decisions around substances. We have an alcohol-based program, an alcohol literacy challenge, and that really goes on to a lot of the social media aspects that we've all been talking about. It's actually a really unique program if you're not familiar with it. It gives the students the ability to really critically think through marketing and social media and figure out what that underlying message is that they're sending and kind of break down those walls so that they can realize, hey, this alcohol isn't actually doing anything. It's a depressant. It has neurological breakdowns. It's not going to make me feel that confident, outgoing thing that all these ads and social media want me to believe.
So I'm curious. It sounds like the Hanley Foundation has been able to integrate within the local area and be able to get into schools and things like that. But I'm sure there are a lot of people who are like, boy, I wish I had that opening. What did the Hanley Foundation do specifically to get into the schools where they were welcome and were there barriers that you had to overcome? Can you talk about that?
Go ahead.
So that's a great point because us haven't. Some of us do have those walls there, and it's one of those things like we're all saying, we wish everyone had their hands and arms wide open to us to let us share our resources. I mean, we're offering free grant-covered resources to give these students life-saving skills, but you'll still hear these teachers and these parents say, oh, my kids don't have that problem, or we're a part of a church group. We don't deal with that here. So it's really just going in with those stats and showing them, hey, this is a real issue here. Going in with those personal stories and telling them this can make a difference. Sometimes I'll even go in. Me personally, I was one of those students that was impacted by DARE. I mean, I'm sitting right here just as proof for it. So, and if they don't let you in, okay, you keep going. You go to the next one. You keep trying. You keep making those other connections. And sometimes that one contact that wouldn't let you in when you were emailing those teachers, that next teacher will be a referral for you. One of my favorite things to do if there's a school I can't get in contact with or they haven't been letting me in is to have another teacher that's friends with a teacher or a contact in that school, send them a quick email and tell them how amazing our programs are. And then it gives you a lead in. So a lot of it is about that networking and perseverance.
Excellent. All right, it's all your all's turn. That was like 2 or 3 from me. Any question? Did you notice how I pluralized my Southern? All y'all? That's everybody.
Hi. Oh, God, I don't like this. As a fellow prevention specialist, could you go into a little more detail about the clickers and the knowledge check at the end?
Yeah, absolutely. So in order for our programs to be evidence-based, we have to have something that we're measuring. So for all of our programs, we have a pre and post test that we have to do, and we have these little clickers that she's talking about. They're like little phones kind of, and they just let them answer questions as a polling. But those evidence-based programs have to have this data to show that it's actually making a positive impact for the youth. So we'll ask those pre-questions, see what they know. Oftentimes they miss a decent amount of them. And then after we do the program, we can see that they have that increase of knowledge, and we do share that with our teachers as well. And if we see maybe they didn't have an increase in knowledge, that gives us the opportunity to go back and look at what needs to be changed or what we didn't present well. Did that answer your question?
Yeah.
Okay.
My other question would be, although we have barriers, I am also a prevention coordinator. The barriers that you all face with getting into schools and also even community-based groups, how widespread is the Hanley Foundation across the state of Florida?
The last part, I missed it.
How widespread is the Hanley Foundation across the state of Florida?
We are in 34 counties, I believe. Give me thumbs up, yeah, for my people. We're in 34 different counties. So we're all over the state of Florida, which is really awesome. We just got 2 new counties this year, I believe. So it is pretty widespread, and we continue to hopefully grow and expand those resources.
Anybody in the back row have questions? They're all like not even looking at me, not looking at you. Any other questions, comments?
One of the things I would like to say is expand upon what Jennifer Belisco had said earlier about working with the coalitions. That is a key thing for prevention, because we really want to look at how we partner up together to do things. So we're not overlapping services. We know what the data is showing, where do we have to have our needs at, where the resources are, where they're lacking at, and that's where the coalition comes in. They're the gatherer of all of that information there. So it's not just prevention folks that are sitting around that table. It truly needs to be everyone sitting around there, from treatment, law enforcement, school. So when we do come up with those issues, like we can't get into the school, well, why not? How can we talk about this as a community to address this issue? So we look at prevention as the main thing, but it leads into, with all that data, what's happening in regards to treatment, recovery, because we have a couple counties that the prevention folks were the ones that stepped up to be the RCO. And said this is what we need in our community based upon our data. And it wasn't the folks that were doing treatment, it was truly those prevention folks, because they knew the data and they had the folks sitting around the table that were the gatekeepers that knew, hey, here's what we need to go into and here's what we need to do. And they had the folks that were impacted by that sitting around the table. So one of the statements I always love to say, or the saying, is nothing about us without us. And that goes for everything, that the folks that we're working with, that target population, need to be sitting there at that table. And we need to be finding out from them what they need, how we can help them with it, and then how we can make it sustainable for them as well. Not just come in, do something, and then we just pop out and say, oh, we did something good, let's continue on. If it was something really good or great, it needs to continue, and how can we make that continue as well?
Next question. Oh, wait a minute. We got a late arm.
When you're saying that there are 34 counties in the state of Florida, how many counties do we have? 67. Okay, where can we go and look on the website or wherever you have this information to see if our county is in there, and why not? I mean, what makes the difference in, like I said, everybody at the table kind of a thing? How can we advocate for our county if our county's not already in there?
Well, if we're not there, hopefully you already have another prevention provider there. One of the things with Hanley is we don't want to overstep and go into some other counties that there's folks there. I'm from Polk County, and because I work remotely, there's already strong prevention folks in Polk County, so Hanley does not come in to do services there. So that's one of the things that we look at. So if you look at your managing entities websites, they should be able to tell you what prevention providers are there, and coalitions are already there as well. You can also search for drug-free communities, and that'll help you tell or find out what communities or what coalitions are in your community if you can't find it through your managing entity, to help you know what prevention providers are there also.
All right. Next question.
I mean, you've answered almost everything on my little list here, so that's pretty good. So families can play a crucial role in preventing substance use and use. How can we equip adults, parents, caregivers, teachers, to be prevention advocates for the youth in their life?
Yeah, that's a great question. And I mean, there's something that every single one of us can do right now, and that's look at our own substance use. Make sure that we're being a positive role model with our own substance use. Even if you don't have a child, you don't know who's looking up to you. So that is one of the key things that I urge everyone. Make sure, especially if we're in this industry, that we are representing ourselves well. But also, we want to make sure that we're giving these teachers and these parents the skills to be able to have these conversations with their youth. We want to make sure that our teachers and our parents are aware of the trends and things that are going on. Our teachers should know that there are things like highlighter vapes available, or if we have schools that are putting those vape detectors in the bathrooms, what are our students going to lean on instead? Are they now going to go to those nicotine pouches and Zyn because it's more discreet? Being able to equip our teachers and parents with that knowledge is going to be able to allow them to know what warning signs and what products to be looking for so that we can make sure that we're protecting them. But also with our parents, having those tips of how do I even have this conversation with my youth? Sometimes it can seem scary, but it doesn't have to be that long, full hour conversation of how bad drugs are. It can be a quick 60-second conversation throughout the month. If you see it in a movie or you're going to the gas station and you see a vape, take that opportunity to say, hey, what do you know about this product, or what do you think about it? But then teaching our parents how to handle that question time. We don't want to interrupt our youth when they're telling us the information that they know, and we don't want to overreact, because if they tell us something and then we immediately go, oh my God, how do you know that? They're going to shut down. So we want to let them fully share all the information that they're willing to share with us. And then after they've shared, take that moment to correct any misinformation or misconceptions, set your family standards. So it really is, I could go on about this, trust me, but I will leave space for other people to make comments and I'll jump in. But those are some of the basic things. It's just teaching our parents and our teachers how to have these conversations and the knowledge that they need to be aware of with substances.
And even having your kid in the car is a great time to have those conversations, whether it's the conversation about drugs or what do you want to do when you get older. Having those positive talks with them. If you could travel any place in the world, where would you go and why? And you have their friends in there. Ask the same question. Some folks, some of the kids, when I did that with my daughters in the car, their friends were like, no one's ever asked me that before. Or what's your favorite car, and how would you, what's your dream? If you could change anything or do anything in the world, what would that be, and how would you get there? So it's like asking them those questions, or even opening it up to them saying, if I'm asking you questions, you can ask me questions, but just be mindful, I'm not going to tell you about my drug use if that's something that I'm not comfortable saying, or if you're talking about sex with the kids, which sometimes can lead into other conversations, it may not be appropriate at that point in time, because you really wanted to find out about them. You don't want to glorify and say, oh yes, I use, but I'm still a great mom with you. Yes, that may have happened, but also we want to let the kids know that there's some realities to that as well. But it needs to be a two-way conversation, that if you're going to ask them questions, they should be able to ask you some of those same ones, and be prepared to answer some of those.
I'll add on quickly too, just to a few different things that we've already talked about. Like predisposition, we all know, have those conversations with your youth. If you do have that family line, it can be really empowering to our kids to know that they don't have to follow that line. There are things that they can do right now to hopefully prevent that future substance use disorder. So letting them know, if you don't use in your youth, you're decreasing that likelihood drastically. That can be really powerful for them to really be able to take control of that situation. Also, have conversations about mental health. Let your students or your kids know, hey, if you're struggling with concentrating, come talk to me. If you're feeling sad or anxious, come talk to me. So that can hopefully prevent them from going to that friend to get that Adderall that, it could have that illicit fentanyl or xylazine in it.
So the other thing that I think is really important is to educate on protective factors, because that's the antidote to a high ACEs score. So, personally, I have an ACEs score of 6, so which means I was predisposed to having substance use or other chronic diseases. But had my family been involved in protective factors, like having the conversation about what is resilience and how do we build resilience, or the different levels of childhood development, educating on that, all the protective factors. The more families know about that getting family support is so important. The easier, not maybe easier, but the more likely the person is going to not develop those negative outcomes from a high ACEs score.
So there's a program called Talk They Hear You through SAMHSA, Substance Abuse Mental Health Services Administration. We do use that as our coalition to put out to parents, and I present at PTOs, SAC committee meetings, and it's just like you guys were saying up there, it's basically getting to the grassroots of keeping the conversation open and talking. Not just questions like how was your day, but really getting into different questions to elicit long responses about what's going on in school. But that program has a lot of resources on there. They're free. I know they'll mail them to you. They also have apps that parents can download on their phones. So it's a really good resource. So I just thought I'd put it out there.
What was the name of it again?
Talk They Hear You through SAMHSA, Substance Abuse Mental Health Services Administration. It's a chunk word, but it's SAMHSA.
Yeah, and going back to your risk factors, that's one of the things that we address with the programs is the risk and protective factors. Of course, it's increasing those risk factors and addressing or decreasing those the risk factors, but increasing those protective factors. We also do a training called SAPS, which is the SPIF application for prevention skills training. And that is mainly geared towards preventionists, but we highly encourage anyone to go through that because it talks about the whole continuum of care. How do we work through and have that common language? How do we increase those protective factors in whatever we do? How do we even recognize those? And some people think that some of the risk factors or protective factors are common sense, and there's evidence base behind those. So it's really prevention is looking at the science of it, looking at data. We're not out here doing things because they feel good. There really is a reason behind what we select and why we're selecting what we do, the programs that are out there. And it really does come down again to that coalition, looking at the data. Are we addressing those targeted populations that we need to in a meaningful way? Do we even have the right facilitators out there doing this? It's great to see that we have more males coming into the prevention world because it really was heavily dominated by females. And we do need some more males out there to show a lot of our teens, both male and female, that yes, there's guys out there that really want to see that you are doing a great thing and going well. One of the things I want to point out about Shelby and some of the other ones that go into the school, they listen to what the kids say. And then they come back and they do some research on what the kids have been talking about. And they share it with the rest of us. It's like, I would have never known this because I'm not in the workforce. I'm not out there on the feet on the street like these guys are, but they'll come back and they'll have some different terminology for us. And we're like, wow, didn't know what that was. But they're great about sharing that information with the rest of the preventionists so that they can hear this and they know what the kids are saying. So we're not going in there totally blinded and the kids say something and we have no clue what it is. It's like, oh, we'll get back to you if we don't know what it is. Because, of course, we don't want to lie to them and say that we know what it is. But if they say something new, write it down, research it, find out more about it. And then how can we encourage it or educate the others about this? Even the teachers need to know more about that as well.
So, Shelby, is that something that we can access? Just any of us can go find out what you're finding out in schools and kind of the recent things that you're finding out about, like those vaping things you just talked. I'm like, I don't even know what you're talking about. But is there somewhere we can find that resource, or you provide that resource somehow or that information?
I would suggest two things. One, you can absolutely contact me or anyone at Handley. We're happy to have those conversations, and we do want to be that resource for the community. And our website has a wealth of information on it. But also, like Lisa's saying, our coalitions often know this information as well, and they're actively working to share that with the community. So lean on those coalitions in addition to, other prevention resources and Handley website and things along those lines.
Great.
And I do want to give shout out to the Community Coalition in the back areas here as well. They do have information on their website, so it's ccafl.org. And they work with a lot of the coalitions in the Northeast region there, so they do have some resources on their website.
I have a question for Lisa. In your bio, it says that you are the statewide certification study group committee lead. Can you talk more about that?
Yes. I hope to retire in 4 to 5 years. Yay. I've been doing this for several years. But one of my goals is, and I've always talked about this wherever I went, is sustainability. How can we sustain what's going on? And how can I see what the progress that I've seen happening in the state of Florida continue? We've had lots of folks going through the certification, and then we've had folks drop off. We had folks that tried to go through the certification but didn't understand the process. They got frustrated with it. So I got 3 other ladies to work with me. So there's Daphne Lampley from Operation PAR, Chrissy Paris from Baycare, and Diana Ramsire from Charlotte Coalition. Between all 4 of us, we have over 100 plus years of experience, and we've seen this need to get more folks to go through the certification process. So it gives that credentialing to that prevention field. There wasn't a whole lot out there. We were pretty much left to flounder. So we do a monthly meeting, and we have a test that everyone, as much as they can, complete that. It's just 10 questions that they have to go through, and they're sample questions right off of the test. And then we talk about more the coalition side of it, because the test is heavily focused on the coalition side of prevention. So we do some type of focus group in regards to that. So this month here coming up, we're going to talk about it's not the continuum of care anymore. It's the spectrum of emotional behavior, health, something. They just changed the name of that. So we're going to start talking about, we always do some type of little snippet in regards to that. Then we also go over the questions. We tell them where they can find those answers. We give them study tips, how they can figure that out. And on the back side of that, then I also meet with folks one-on-one to show them how they can look at their college transcripts. I work with the Florida Certification Board if we have questions in regards to this as well, that I don't answer it. I go straight to them and say, here's a question that we have. It's not laid out in your handbooks. How do we address this, such as supervision? A lot of folks don't have a supervisor that can sign off on them. So it's like, okay, can we do ABC with them? We have some folks that have their degree from another country. So how do we use that as part of their certification process? Because we can use 20, in a classroom, we can get 20 credits off of that. So I help them see where are they at, breaking down their college degrees, put it in an Excel spreadsheet for them, and then show them where they can get their trainings at. We've already found 21 different websites. We link it up to each one of the domains. So all the work is done for them. In regards to what the resources are, it's just either A, you gathering your certifications or your certificates up, or B, you start taking these trainings, and then we can make sure that you go through and then have those study tips and the questions for you.
That's fantastic. I have a few follow-up questions, and I'm glad that you were working with the certification board. That was going to be one of my follow-up questions. If someone wanted to participate in this group, how would they go about getting involved?
If you email me, I'll put you on the distribution list, and then they get the link to attend the trainings, or the sessions, I should say. And once they are registered for one, they're registered for all of them. And then they get follow-up emails right after each session that we do. That's even if they don't attend, we record the sessions so they can follow up and find all that. They have past ones that are on there that they can watch as well in the Google Drive. So all the information is there for them to go back and forth on. And any of the resources that we have are directly linked in there as well.
And the most difficult training to come by is the ethics training in prevention.
Yes.
Are you planning on providing one of those soon?
Actually, 5 of them this year.
Thank you.
Yes, it'll be, and we just did one as a pre-conference at the Behavioral Health, at the FATA conference there. So we'll continue to do that one again next year. We'll have one coming up in Lee, Manatee, the southeast one. And then we also have one coming up in Henry Glades. But if you need, you're up in the Nassau County area, right?
I am in Nassau County, yes.
Yeah, so we can also work in regards to that.
Yeah,
up there as
Northeast
well.
Florida, we can.
I've gone up there before too and done some different areas. So,
And last thing, not a question, just a bit of information. I sit on the Florida Certification Board of Directors, so full disclosure. We have asked Department of Children and Family to expand our contract that we have using the opioid abatement funds to pay for scholarships for the peers. I've asked them to expand that to cover prevention certification. And we are just waiting for a contract amendment to come through, and then we can use those funds to help pay for prevention.
that would be great. And the Florida
You're welcome.
Yes, thank you very much. Florida Certification Board is actually going to be speaking at our October meeting. So they're going to be our presenters for that to talk a little bit about the process behind the scenes. But we appreciate that because it is a little costly for some folks. Some agencies reimburse them after they pass and some do not. It's all within that person to do that. So greatly appreciated.
All right, we have just a couple of more minutes. Do we have any final comments or thoughts from the audience? From the panel? Any questions or thoughts or comments? All right.
A hand up in the back.
Oh, we got a hand. Oh, okay.
Oh, back row.
All right, Kathleen.
Good. Yeah, all right. Thank you.
Hi, everybody. My name is Kathleen Roberts. I'm the CEO for Community Coalition Alliance. I love the enthusiasm in here for the input here on the training pieces. I just wanted to also share that we do have a variety of different prevention trainings that we have on our schedule. So if you go to ccafl.org/training, we also are working a lot with Florida Certification Board to be able to offer CEUs for those kinds of things. Because like Lisa was saying, it's one of the things that's been kind of, a challenge with trying to get everybody and finding what are those different courses that you need. So we have those listed there with the types of areas that it will fill in for the requirements for the certification process. And I love to hear the work that's being done to support prevention. That's fantastic. It's not something we always hear, so it's so exciting to hear that. And being able to work together is exactly how we're going to get this workforce more forward. We already have such great work happening. This is just going to help strengthen everything. So just wanted to add that.
All right. Any follow-up comments? If not,
I'll have the last word then.
Well,
and then I'm
yes,
gonna
you
hand it off to
can.
Melanie. So
You can.
I just want to thank everybody. Thank you for interacting. Thank you for asking questions. I've learned a ton. I learned a lot. Hopefully everybody learned something. I learned quite a bit. The last thing I'm going to remember is talk, they listen. Talk, they hear. Talk, they hear. Because I remember as a kid, I never listened. Whatever my mom said, blah, blah. It's like Charlie Brown's, teacher talking. But I actually did hear it. And then I kind of remembered, okay, I've heard this somewhere before. And then when I'm in the throes of whatever I'm doing at the time, it's in the back of my mind, my mom telling me this, right? So keep talking to your kids. That's important. They probably do hear you, even if it doesn't look like they're listening. So, but thank you very much. And thank you for all the panelists too.
Yes.
So thank you so much, Dr. Stavros. We really appreciate you being here today and moderating our afternoon. A big round of applause for Dr. Stavros, our panelists, and Dr. Solomon. So I too, just the takeaways today are all the way from advocacy to pharmacogenetics to perseverance to talk and have the conversation, educate folks, all of those bits and pieces that we've learned today. I hope it sparked some initiative in you and maybe a way to get the wheels of innovation turning. And now you've got some resources that you can reach out to so that we can make lives better for the clients that we serve and do some prevention work as well as some treatment work. We thank you all for being here. If you want your CE, check in at the desk. And other than that, we hope to see you next year. Thank you.